when a parent comes to you for their first nephrology visit, how does it go? Like, what should they expect? What kinds of questions should they ask? I guess it kind of depends on why you're seeing the kid, but
Yeah.
I mean, do you have a general format with how you introduce them to pediatric nephrology for that first visit?
Yeah. Well, first they're gonna get their vitals taken, just like at any other pediatric visit. But blood pressure is really important in nephrology, so you may get your blood pressure checked many times to make sure we get an accurate one.
Hmm.
Then we're gonna go over personal history, the other medications you've been on, medical problems you've had, surgical history, and family history is very important. And then whatever imaging they've had, I'll review that with them again. Whatever labs they've done that brought them to me, we'll go over those together. And then we'll go with what's the game plan? What do we have to do right now? What do we expect in 5 years? What do we expect as an adult? That really matters to parents. Like, will my kid be able to go to school? Will they be able to have children of their own one day? What do I expect with this disease? So I can usually lay that out.
The tests in the office.
Mhm.
What tests are you doing in the office? Obviously, you're doing blood tests.
Yeah.
You mentioned the urine dipstick. What is that?
Yeah, so we get a sample of urine, in a cup, and we can analyze the pH, so the acidity of the urine, and if how concentrated urine is, it's called specific gravity, if there's red blood cells, white blood cells, and signs of those things in the urine also all come out in just a couple seconds, test. Yeah.
And you'll do ultrasounds from time to time?
We'll send them to the imaging center for
Okay.
ultrasounds, but some people do ultrasounds in office. Yeah.
Maybe I'm just liberal as a autoimmune pulmonologist. I always want a biopsy. Like, I want
Oh,
tissue.
yeah.
Like, I want to see the tissue. I need to see what
Yeah.
type of white blood cells are in there because it'll help me select a immunosuppressive agent
Yeah.
sometimes. But in kidneys, like, everybody's always like, no, no, we don't need the biopsy yet. Like, we can wait. We can wait. Well, like, what's the deal with that? Like, I feel like you can get a lot of information from that kidney biopsy. Why do we wait longer than I think?
Well, because you're working with grown-ups. In kids, we do biopsy if you don't meet a kind of a perfect textbook case of something that we can treat. So if you are a textbook case of post-infectious glomerulonephritis, you had strep throat, and now you have nephritis, and we know we just need time, and your labs are getting back to normal, we know we don't have to biopsy you.
Yeah.
But if you are outside of that age range for a nephrotic syndrome, minimal change disease, or if there's a weird family history of anything at all, we're probably going to biopsy a little bit sooner. The good thing, we do have more genetic tests that we can avoid biopsying. So if you're worried someone has an Alport syndrome, we can do a blood genetic test and avoid having to put them under anesthesia. Anesthesia is not benign in kids, so I'm careful before I recommend a biopsy, but we do biopsy probably a little bit more than the adults. We also call chronic kidney disease a little bit sooner than the adults because we get nervous about chronic kidney stage 2, whereas internal medicine doctors feel a little more comfortable managing that.
Yeah.
But pediatricians, want to preserve the kidneys for a very long time. So,
Yeah, because they have a lot more runway.
yeah,
There's a lot more time for them to live.
yeah.
How do you explain tests to kids in a non-scary way? Like, what
Mm.
you're gonna do? Like, how do you talk to them?
They're child life specialists. These are amazing professionals I get to work with, who come in with great illustrations for kids and dolls that have catheters on them
Oh.
or blood pressure cuffs on them, or, who can help explain these things. But we also, you know, try to tell kids up front exactly what's going to happen and if something's going to hurt or not, and if they're going to be alone or not. So I think as long as they know their parent is there, or I'll be there, or my friend will be there
Yeah.
during this kind of scary x-ray, they can put up with a lot. And that's why I love kids. They're so resilient.
Kids are great.
I see them go through things. They don't want to be sick.
Right. I mean, I had no issues with the kids. It was the parents. Right? Because parents get very, I mean, I get it. I'm a parent.
Mhm.
Like, we get very emotional. We get
Mhm.
very fearful,
Mhm.
right? We get anxious before whatever happens, where it doesn't really exist, but
Right.
but we have this anxiety.
Yeah.
How do you deal with that? Now you're a parent, so you get it, but how do you cope with that? Because most of the time, the kid's probably sitting there like, okay, like, this is my normal, I get it, right? But the parent's like, oh my God. So how do you deal with
Yeah.
that?
Yeah, I think you just have to go case by case, I've had a lot of practice with people who are more emotional, and you can kind of ask, like, "What are you afraid of?" And if you can get them to name it, then you can start addressing it. I think there's just lots of different types of adults, so you just gotta treat it like, "Okay, this is a new challenge to have them trust me, and how can I build that trust?" Because we all want the same thing. I think whenever we say, "I want your child to be healthy, you want your child to be healthy." Like, how can we do that in your home, in your circumstances, at their school,
Yeah.
And once they agree that we're all on the same team, we can move forward even if it's a little bit of a rocky start.
We have this office visit, overwhelming sometimes. It's a lot. A lot of times it's more than just following up.
Mm,
It's actually treating.
mhm.
When do you know when to treat a kid's chronic kidney disease or acute kidney injury or whatever?
There are a lot of objective markers, which is why I like nephrology. We follow vitamin levels, so, like, vitamin D is something early on in kidney disease that we're often correcting. And giving kids either liquid or a pill. And same with high blood pressure. We check that very closely because we're trying to protect the child's heart, eyes, brain, for the future, and kidneys for the future. We have all these guidelines of when to start treating. We don't sit on a whole lot of things. I think I see kids back pretty soon for their results to follow up and start them on treatment if they need it, or spend the night in the hospital if they need it to kind of expedite their workup for whatever I'm seeing them for, be it a new nephrotic syndrome. So kind of use that 24-hour time for both evaluation and starting a treatment, making sure they're going to be able to do the treatment at home. Sometimes kids spit out their medicines and their parents are like, freaking out,
Yeah.
"Well, how am I gonna do this?" But pediatric nurses know how to teach them exactly how to do it.
Yeah.